Hi everyone, my name is Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center.
Hi, I'm Dr. Jay Apurao. I'm the cosmetic surgeon here.
And today we're going to talk about Brazilian butt lift, what that means, what patients are candidates for it, and we're also going to talk about what you're reading in the news and the dangers, and kind of hopefully clarify exactly what this procedure means. So I guess we should start by saying Brazilian butt lift is not butt shots.
Yes. Let me start by saying, first of all, the name Brazilian butt lift is not a true lift. It is a marketing idea to say that. But reality is, it's a shaping procedure for the butt. It includes liposuction around the butt and putting the fat back in the butt to round the butt according to desires. So it's a shaping procedure. It involves a lot of steps. Fat transfer is just a part of it. A lot of people think it is a matter of injecting some silicone in the butt. It's not so. People have tried those kind of things. Those are highly complicated. A lot of dangerous complications from that. Don't ever try silicone injections in the butt.
With that being said, the dangers that we're hearing and seeing in the news is getting injections in hotel rooms, at their houses, meeting people in different areas. This is a medical procedure. It should be done by a surgeon, by a doctor, someone that knows what they're doing in a hospital setting, whether it be inpatient hospital or an outpatient hospital. Because it is a fat transfer, liposuction is involved, and that is a procedure in itself. We harvest the fat, like you said, from all the areas that you don't want, and we do a bunch of different tricks to make the fat survive and inject it back into the areas that you do want. So it can be injected into the butt to give a nice shape or a subtle lift, if you will, but it also can be injected in other areas as well. So Brazilian butt lift is really known as a fat transfer by itself.
Yeah, basically Brazilian butt lift, just like she said, is a fat transfer procedure. Take the fat from one area and put it in another area. What you have to remember is fat is a living cell. When you take the fat from one area and put it in another area, a lot of it just dies away. There's a lot of tricks to be done to make sure the longevity of the fat is good. If you straight away simply inject the fat that you took out and put it in any other place, 70% will die. There are a lot of technical steps involved in trying to change that into 70% survival rate. And that is a technically challenging procedure that we do. Brazilian butt is certainly part of it. But fat transfer can be done anywhere else in the body too. You can also put the fat back in the breast and some defective areas in the body. We can put it in the face to augment the cheeks, chin, and different parts of the area, or fill up the temples. So fat transfer can be done in many locations, any location in the body, but it requires a lot of technical skills and aesthetic skills too. So don't take it lightly. It may be a procedure that may have to be repeated sometimes because we can't put too much fat and that'll kill itself. We can put too little fat, it may not be enough. Occasionally, we have to repeat the procedure to get optimum results.
So a lot of patients think whenever you get liposuction, if we take out gallons of fat, that all of that can be turned around and injected back into different areas, and that is not the case at all. I don't know the percentage, what you would say, out of a gallon fat, how much of that is actually survivable?
Yeah, it's not exactly, when we take a gallon fat, there's a lot of stuff in it, such as RBCs, red cells, white cells, plasma, fluids, blood cells, different products are there. We need to eliminate all of that and get just the pure fat. Out of the pure fats, 70% will normally die if you just inject straight. But if you treat it, clarify it, inject it in droplets, then we can get 70% survival rate. In some areas, we can need to increase that from 70% to 80-90% by adding what's called platelet-rich plasma. So that's another whole technical detail involved there, so we won't go through that, but we can do a lot of tricks to make it much better.
So what we would tell our patients is anyone coming in for liposuction that are interested, just know that a fat transfer Brazilian butt lift is an option. That's the only time you can use the fat. So whenever you come in for your consult, just keep that in mind, that if that's something, if you're deficient in certain areas that you want filled, talk to the doctor about it, see what we can do, and see if we can harvest it for you and put that back in the areas that you need.
Yes. I just want to say one more thing. There is a procedure called butt lift, which has nothing to do with fat transfer. Some patients do not qualify for Brazilian butt lift. To get a Brazilian butt lift, you need to have two things. You need excess fat elsewhere, number one. Number two, the gluteal area needs to be reasonably shapely to make it better. If it is actually significantly dropped, it needs a surgical lift. That's not the same as Brazilian butt lift.
And on that note too, patients that really have no fat to be harvested and want a better shaped butt, what would you tell them?
Yeah, we do
Implants?
have butt implants available, just like breast implants. But I just want you to, word of caution there, we do butt implants here. If you don't have any fat and you need a better butt implant can be placed. But they are not the same equivalent to breast implants. There are lots of complications to it. So complication rate is pretty high to butt implants compared to breast implants. Keep that in mind, but it can be done. Some people that'll be the only option available.
So again, whenever you're interested in either one of these procedures, call the office, schedule your appointment, and when you meet with Dr. J, he will give you the best advice and the best opinion on what options we can do for you.
Thank you.
Thanks.